Welcome back to this special edition of Exclusive Doctors DFW. Now to the story of Sarah and Steve. Like many couples who choose to start their family a little later in life, Sarah and Steve encountered some problems. That is until they received help from infertility specialist Dr. Mika and they found success to be twice as rewarding than they expected.
We were trying for a couple of years and we're not having any success, and a friend of ours actually had started seeing Dr. Thomas and referred us to her, and as soon as we met her on the first visit, we knew we were in awesome hands, and that's where we should have been all along.
Neither one of us are in our 20s anymore, so we knew that that just raises the difficulty and some of the risks. So we knew we had challenges just because of our ages as well.
So Sarah and Steve have been trying to get pregnant for about a year and a half before coming to see me. And we opted to start with a less conservative form of treatment called an IUI, an intrauterine insemination. Unfortunately, it was not successful. Steve's sperm counts were too low, so at that point we opted to move forward with the treatment called IVF, or in vitro fertilization.
Our IUI didn't take, and so we then went sort of do not pass go, do not collect $200, go straight to IVF. And we did ICSI just to make sure that we were getting the maximum return on the eggs and sperm getting together. And we also did the PGS genetic screening just to make sure that we had healthy embryos that we would be transferring when that time came.
The entire plan was to thaw one single embryo. And when the embryologists thawed that embryo, they felt like maybe it didn't have the implantation potential that they had hoped for. It didn't quite have optimal quality. So after discussing this with the couple, we opted to thaw another embryo. So we actually transferred 2 embryos.
So we were given, a short window to make a pretty quick decision about whether or not to transfer a second embryo. And Dr. Thomas recommended it, the embryologist recommended it, and so we obviously trusted them, and they said, well, we think the chances of twins, it's there, we're not really sure how it'll turn out because our situation was a little bit weird. It was one that they had never really seen before. And lo and behold, now we have 5-month-old twins.
Now we've got 2 amazing little young men that we can't wait to watch grow and develop. From the moment they were born to right now, I mean, they're starting to actually show personalities and facial features. They're starting to laugh.
Dr. Thomas was great. She really sort of matched our level of, quirky and sort of just, our personality was a great fit. It's a very emotionally heavy process, and she helped make that so much easier. But I think she got a kick out of it when the pregnancy test came back that we were having twins. I think she had a pretty good laugh about it and told us that by the time, about 7 years from now, we're not going to be able to keep food in our fridge. So we know we have that to look forward to.